Knock, knock, knock. Hey, Bob. My name is Noah. I'm going to be your nurse today. I'm going to be performing some tracheostomy care on you. Okay, Bob? I'm going to perform hand hygiene, verify patient identity using two forms. Once I make sure that this is Bob, I will raise the patient's bed to the semi-Fowler's or Fowler's position to increase oxygen flow, make it a little bit easier to breathe, and to improve positioning for taking care of his tracheostomy. Once he's in the proper position, I will set up my supplies. On the bedside table, I'll have a tracheostomy kit using sterile technique. I will open the tracheostomy kit. I will remove gloves, remove the towel, and I will remove the ties. The towel I will place over Bob to help keep him nice and dry. Ties I will set up for later. I will have sterile saline solution and a soaking solution that I will pour into separate containers on my tracheostomy kit. I will leave the sterile saline uncapped on my table, and then I'll proceed to go take care of Bob's tracheostomy. Once the field's set up, I'll perform hand hygiene again. Put on clean gloves. Hyperoxygenate the patient if necessary. Once we're secure, I'll go ahead and remove the source of oxygen. And very gently, I will secure the tracheostomy and remove the inner cannula, following the curve of the tracheostomy. And I'll place that in the soaking solution. I'll then return and I will remove any dirty dressings that are present. I'll remove the dressings. I will remove my gloves with the dressings and I will discard. I'll perform hand hygiene and I will clean the inner cannula. In order to clean the inner cannula, I will apply sterile gloves. Grabbing the outside of the cannula with one hand, a non-dominant hand. I'll hold on to the outside of the cannula. My other hand, I will take the brush and brush the inside of the cannula, the outside of the cannula, making sure to remove any debris or secretions that have gotten stuck on there. Once the inner cannula is clean, I will rinse with normal saline solution, pouring through, ensuring to wash off any leftover remaining debris or solutions. I will air dry, cleaning out the cannula by tapping on the side. And then I will return the cannula to the tracheostomy by returning it in the direction that it came out, locking and securing it into place. Once the cannula has been secured into place, I will return the oxygen source to the tracheostomy, and then I will proceed to clean the tracheostomy and the phalanges and the skin around the stoma. Using 4x4s and cleaning swabs, I will clean this around the stoma site from 2 to 4 inches out, going in a circular motion. And I will ensure to clean the phalanges and ensure that any grime is removed. If there's anything that is stuck on, I will remove it using hydrogen peroxide solution mixed with saline. I will thoroughly clean around the flanges, make sure everything's nice and pretty. I will discard any cleaning supplies. Once I'm finished cleaning, I will return with a dry sponge and I will dry around the stoma area and the phalanges of the tracheostomy to ensure that there is no tissue breakdown. I will make sure to dry everything. Once everything is dry, I will discard those sponges as well. and I will provide with a new clean dressing for the tracheostomy. Very carefully, I will slide it underneath the flanges on either side with the tie still in place, ensuring not to dislodge the tracheostomy. Once the dressing is in place, I'll then replace the tracheostomy ties. I'll remove this since we are done cleaning. Discard. Get my ties. I will take one end of my ties through one edge of the flange, leaving my old ties in place in order to help me secure the tracheostomy since I am by myself. I will pull the series of ties even, and then I will pass both strings around the patient's neck, sliding it behind, and then pulling it through. Once I have pulled it through, I will slide one end through the flanges on the other side, pulling it taut. I will ensure tightness by checking with one loose finger underneath or two fingers tightly underneath. When we have the proper positioning, I will tie the two strands together on the side of the patient's neck so that they're not laying on the knot. I will double knot it in place, and I will remove the old series of ties by cutting, removing, and disposing. I will then take a clean 4x4. I will place it under the knot that I have created, and then I will secure the knot using tape to the dressing so that the knot does not come undone and so that it does not inadvertently press on any of Bob's tissue. Once the ties are secured and they have been secured using tape, I'll make sure Bob's okay. I will return the bed to the lowest position. I will return Bob his call light. I will remove my sterile gloves that aren't sterile anymore. I'll perform hand hygiene, and then I will leave to document this procedure.